My immune system is my enemy. There are days that I cannot leave my bed. I have ankylosing spondylitis. My struggle is more than just aches or pains. I always had this very blunt, very persistent pain in my lower back, and it really affected me because at that point of time I was training very competitively. Because of that, I wasn't able to train properly. There was this time where the pain was so bad in the morning that I couldn't even get up from bed. Like, I couldn't even roll over to my side. So I actually had to use my phone to call my mom to help me sit up from bed.
Clement was actually seeing one of my colleagues for some shoulder pain, and at that time this colleague suspected it was more than just shoulder pain and ran some tests which suggested he might have ankylosing spondylitis. AS is an autoimmune disease where the body's immune system, which normally fights infection, instead attacks various organs, in particular the spine, other joints, and occasionally the eyes.
There is currently no known cause for ankylosing spondylitis. Patients at risk would include patients who are genetically susceptible. For example, they have the HLA-B27 gene, or they have a known family member who has ankylosing spondylitis. These group of patients may be at increased risk of developing ankylosing spondylitis in future. There are currently many treatment options available for ankylosing spondylitis. Exercise as well as regular physiotherapy is a must for patients. To relieve pain and stiffness, we often use oral medications such as non-steroidal anti-inflammatory agents, commonly known as NSAIDs. Newer therapies will include biological agents. Biologics are medications that target specific substances that cause inflammation. Biologics are safe and very effective in the treatment of ankylosing spondylitis.
The treatment has helped Clement in many ways. I think our treatment is fairly broad and it includes understanding more about his condition. Clement also was very diligent with the course of physiotherapy that was prescribed and also with the medications that were given to him. And I think all of these working together helped to improve his condition significantly, and he was able to continue competitive swimming and won medals at both the Asian and SEA Games.
AS really is more painful in the morning because the joints are really stiff. So it gets better throughout the day, and especially if exercise. So I think exercise makes it a lot more manageable. So through the medication and treatment, the pain has actually become a lot more manageable. Like, although there is still this very blunt and slight lower back pain, but then I don't get those flares as much. Because the flares are really the ones that cause me a lot of pain. I think I don't live very much differently from a normal person actually. I go about my daily life as any other normal person would.
The long-term prognosis for patients with ankylosing spondylitis is generally good, especially if they are treated early in their disease. There are many patients who go on to do well in their careers. For example, they are in the army, they are firemen. You should see a doctor if you are below the age of 45 and have chronic lower back pain for more than 3 months. Do seek medical attention early.
My immune system is my enemy. There are days that I cannot leave my bed. I have ankylosing spondylitis, but that will not stop me.